Hello, I am your host, Kathy Chester, and welcome to the Move It or Lose It podcast, a podcast about all things that move the mind, body, and soul. The Move It or Lose It podcast is for information, awareness, and inspirational purposes only. I am not a doctor, and I don't even play one on TV, so please consult your doctor before making any medical decisions. The views expressed by advertisers, guests, or contributors are their opinions and not necessarily the views of the Move It or Lose It podcast. Welcome to Move It or Lose It. We are back again with Dr. Joshua Katz. We have been talking about all sorts of stuff. We've been talking about MS and some of the clinical trials, and we've been talking about HSCT. And the last one you might have remembered, Hannah Butler shared about her experience with HSCT. And today we're going to let Jacob, I'm not even going to speak for him, I'm going to let him share his experience with HSCT, and Dr. Katz is here, and he's going to help explain things that I won't be able to, and I'm so grateful that he's here. So thank you again, Dr. Katz, for being with us.
Yeah, my pleasure. Well, thanks for having me back.
Absolutely. So, Dr. Katz, you were so insightful. Thank you for sharing your thoughts on Hannah's experience that she had and making her feel better that she went with her gut and that she doesn't have that. I think that was beautifully said, the words that you gave her, and not regretting it, but understanding when you're in pain and you don't feel like you're going to get better and you don't know what to do. You did what your heart said and you did it, and you don't go back and second guess it when feel like there's no answer. You did what you felt was right, and who knows what it would have been if you didn't or did. So, Jacob, you are up, sir.
Hello.
Please share.
Thank you. My name is Jacob Kinch. I live in Boise, Idaho, and I was diagnosed with MS like the 8th day of 2018. So I started like really quick out of the gate. I started on Copaxone. I couldn't. I can't remember what the test was. I believe it was like they checked for something called like the JC virus. Is that accurate? Where I couldn't start Ocrevus.
Okay.
And
wait, that would be a test to see if you could be on Tysabri.
Yeah.
I totally mixed that up. Well,
that's okay. Happens all the time.
Mm-hmm.
There was something that they said where I couldn't do Ocrevus either. I don't remember what that was. And just so you know, when I was diagnosed, they diagnosed me with relapsing and remitting. And the way that they were able to tell me which version I had involved, like I was already diagnosed from an MRI. And then they were like, oh, we could tell you what kind of MS you have through a spinal tap. I've had multiple neurologists since tell me that was
ridiculous.
Yes, and also I had the dural leak with that spinal tap, and never again.
Same here, man.
It was
gosh,
it was so bad. It was so bad.
Well, so I'm going to take a moment to defend the spinal tap.
Okay.
Just because two things. One, you're correct. You can't diagnose what kind of MS somebody has by looking at their spinal fluid. You can't even really do it by looking at an MRI. The only way to do it, really, it's a clinical diagnosis.
Okay.
So it depends on how you look, which is one of the reasons why it's probably not even that accurate, because basing diagnoses on somebody's symptoms, some of us are really good reporters, some of us are underreporters, some of us are overreporters. And so it mixes things up. But the dreaded complication of having a spinal tap is these spinal headaches, where every time you sit up, you get a bad headache, and they can last for a long time until you get something called a blood patch procedure, which maybe you had. We used to think that the way to prevent that was to lie you down for 6 hours after a spinal tap. Well, turns out that didn't matter. And then we thought, okay, you got to hydrate really aggressively. Then that doesn't really matter. The one thing that does actually make a difference is the kind of needle that you use. And so there's a different kind of needle where the opening is on the side instead of sort of at the front of the needle. And if you use that, the risk of spinal tap headaches is very much lower. And since I went to using that kind of needle, I won't say it's zero, but it's just about zero, the number of people with headaches afterward. But the good news is, these days, we rarely need to do that to make the diagnosis. It's only in cases where there's something odd about it or you really aren't sure. Most of the time, the MRI and the clinical symptoms can make the diagnosis. Sorry to go on for a while.
No, it's interesting because I never had my I had spinal meningitis, and I never had a spinal tap for the MS. Actually, I had it for meningitis.
So
Well,
interesting.
good you didn't have to have two. Not that they're that bad. But
No, I had to. I had it twice. I had
Oh,
it as a child, and I had it again at 20. I was like, can I? Who has that twice? But
well,
interesting.
you didn't have to have it 3 times.
Yeah, good. Exactly.
I cannot tell you how excited I am to announce my partnership with FootScientific. Their Elevate 360 drop foot solution is amazing. It's lightweight. It has customized sizing, which is amazing. I've been in braces where they are much too big and bulky. This one has memory foam. It's comfortable. I have walked my dog. I have run with it already. I have danced in it, and it is amazing. It has stainless steel anchors, which you can wear them in any shoe you want to. But to be able to have them connect to your laces so that you can lift the foot so that the drop foot isn't so bad and know that they're safe in there is so incredible. To be able to have this, to be able to have it on your ankle and then attach it to a tennis shoe, to attach it to a heel, actually, or a sandal is absolutely amazing. I cannot tell you how excited I am to be a part and partner up with Foot Scientific. They are truly here to meet our needs. So I encourage you to go on to the website at footscientific.com, check them out, and of course, use my discount code. It is MS Disrupted, all caps 30, and you'll get $30 off your pair. And also, don't forget 60-day guarantee. If it doesn't work for you, then you can return it. And that is why I love Foot Scientific. They're a company that truly cares about our needs. So don't forget, check them out. I love my partnership with them. Have a great day.
Jacob, go ahead.
Anyway, well, with the spinal tap, I actually never ended up getting the blood patch to fix the dural leak. This older nurse who I spoke with at the hospital, she just told me, she's like, listen, honey, you just need to drink some caffeine, and that can sometimes help. And it actually did work.
Okay.
I was so surprised by that. I drank like
Wow.
2-day-old coffee, and I was just like, and then I started to feel better shortly after, which is an insane fix. But
Wow.
Well, you know what happened is that the hole healed itself up, and you didn't continue to leak fluid. Otherwise, you would have continued to have a headache. And the caffeine does make the headaches better. So you fixed yourself.
I guess, and coffee. So
Yeah.
so what happened was they got me on Copaxone because they couldn't do any of the higher efficacy drugs, and I just wanted to do the lightest thing since it was so new. So I got on Copaxone, and my mobility was fine. Like, so the thing that first alerted me that I had MS is that my right leg started to go numb from like my foot to my knee. And so after I got on Copaxone for about 3 months, the numbness spread to both legs and then up to the middle of my thigh. And then I started using a cane. And I'm not saying it was the Copaxone's fault, but it was that the timeline was like on the same.
Well, and we usually don't expect or especially the earlier disease modifying therapies, they don't really even start working for about 3 months. There is sort of a momentum that MS has that's very hard to stop in under 3 months, even for some of the higher efficacy treatments. So going on Copaxone and having your disease continue really shouldn't be considered a failure of Copaxone, in that short a period of time.
Yeah, my current neurologist agrees with that. She's like, I think the progression would have happened regardless, just based on the fact that it takes the drugs that long to work.
Yeah.
So I was on Copaxone for about 7 months, and then I went to a new neurologist who wanted to start me on Gilenya. And so I did Gilenya, and oh boy, Gilenya made me so sick all the time that I stopped eating like consistently. I got down to about 138 pounds. It was
What were you sick with?
just my stomach. Like anytime I took Gilenya, anything I ate came back up. And
Boy, that's a relatively common symptom with Tecfidera and the
That's what I was
food
going
rate
to
drug.
say. Mm.
yeah,
Not that common with Gilenya. That's interesting.
yeah, it was bad. I don't know why it was so bad.
No,
So
doesn't matter.
Yeah, it was, yeah. So then in 2019, so I was living in Seattle when when I was like diagnosed. So then in 2019, I moved to Boise where my family was because I was starting to have, like, my progression was getting worse. And one of my neurologists suggested that I start looking into assisted living, which was that was a hard thing to hear because like I couldn't do stuff on my own as much as I used to be able to.
Mm.
And so that freaked me out. So I was 35 years old at this point, and I'm moving back to where my family is. And then the summer of 2019, I had a really bad I got really, really sick with Gilenia. And then I ended up seeing something on a Facebook post about somebody who just had gotten back from Clinica Ruiz. And so I contacted her and we had a conversation. And then I contacted the clinic themselves and I had like 20 conversations with them because I overthink everything and I had to ask every question. And so I decided I was going to go in May of 2020. And then COVID happened, so they pushed it out to September. But so yeah, and so this was like 2.5 years post diagnosis, and um, I actually had a really good experience, like uh, similar to Hannah, like with like the people and everybody and the staff at Clinica Ruiz. They were awesome, and I had really good results for the first 2 years. Here's what happened. So after I got done with my stem cell transplant and everything, I came back. I was doing great. My progression felt like it definitely felt like it had stopped. I was starting to walk without my cane, and I was able to do things like more that I enjoyed. I even got like I work in the audio industry, like in video games and
My
like in
kids
film and
love this
stuff.
part. They think he's super cool.
So I basically I make sound effects for film and video games, and I hadn't worked for a while, but then I ended up getting like a job, like a really good job, like remotely, and then I was doing amazing the first 2 years. Then in 2023, I got COVID, and it was like it unraveled everything,
Mm.
and my numbness. So what happened is, so my numbness was always up to the middle of my thighs, and then after I got COVID, I've like felt this like tightness, like, like a girdle. So I had a friend who had a friend with MS who had what he called the MS hug.
Mhm.
I thought I had that. Well, it never went away. And then I did another MRI and I'd had some progression in my spine, and my numbness is now like to the middle of my chest, which is really annoying.
Yeah.
But
Well, so your MRI showed ongoing disease activity, it sounds like.
after COVID,
Yeah.
so the first 2 years after HSCT, there was no progression, and in one of the lesions in my brain had gotten smaller.
Yeah.
So I say that as if that like actually means something, because like they had also got like they'd updated their MRI machine, right? So it could have just like, because it's brighter or more dull depending on
Yeah. Hard to
updated.
know. Yeah.
It's hard to know, but I did feel cognitively better. So
Well, you got in a very effective treatment. I mean, there's no question that even non-myeloablative HSCT is a pretty good, it's an immunosuppressant that affects the immune system. It's a pretty high intensity treatment as they go. So it's not a surprise that that made a difference for you, which is good to hear. It's also not a surprise that having COVID, or really anything that sort of revs up your body's immune system, in some cases can, can trigger a relapse and, an ongoing disease activity. This is one of the questions that I have about HSCT, especially if you're using a non-myeloablative regimen, is, how long is that good for? And I don't think we know the answer. And there are other medications that are given intermittently without continuous treatment. So Lemtrada is one of them. Lemtrada is an IV treatment. We don't use it so much anymore because there are a lot of complications with it.
Okay.
But it was actually used as conditioning prior to stem cell therapy in some regimens. And there's also Mavenclad, which are pills that are given in 2 cycles. You get 5 pills, and then 1 month later, another 5 pills. And a year after that, you repeat that cycle. And then you don't do anything unless you have disease activity. And with both Lemtrada, Mavenclad, and HSCT, the question is, have you cured MS or not? And if you haven't cured MS, when is it, does that mean you have to keep monitoring? And how do you keep monitoring? And do you wait to retreat somebody with another disease-modifying therapy only if they show disease activity? Do you wait for that to happen, or do you treat them before that happens? These are questions I don't have the answer to. And these are things that we're trying to figure out. If we had good biomarkers that could predict who needed to go back on therapy and who could stay off therapy, that would be helpful. And those things might be coming. I don't think we're quite there yet, though.
That would be very helpful. Very helpful.
Yep.
Yeah, it's so my experience with HSCT, like even like where I am right now, I would still do it again 100%. Like if I had that money, if I
Right.
that 55,000, if that
Right.
if that magically showed up again, hint, the internet. I'm just kidding. But no, if I would do it again in a heartbeat.
I'll tell you my question, though. I wonder, I can't figure out what condition you would have that would disqualify you from getting an anti-B cell therapy like Ocrevus, Briumvi, or Kesimpta, but that would be okay to get stem cell therapy, which requires an even more severe depletion of your immune system. So I'm not sure what it was that disqualified you from those.
I was born a carrier of hepatitis B. I don't full on have it, but I was like born a carrier, so my liver is has always been
They're concerned about reactivation of hepatitis B.
Yeah.
Yeah. I mean, I would think that could also be an issue with stem cell therapy, but yeah, it's interesting.
Which is interesting because like I went through a whole thing with Clinica Ruiz about it, like getting different blood and blood work, blood tests for them, and it didn't seem to be an issue. It was the only time I had like it was like activated, like was when I was on Gilenya. It just like it was like really bad, and then they had to put me on another medicine to deal with the effects of Gilenya.
Yeah.
But I never had any effects like after Clinica Ruiz with the chemo. And
that's interesting. So are you doing another treatment now?
No, I'm not doing any treatments. I don't like the way that the DMTs make me feel, and honestly, like the cost. If I have independent health insurance, and like even with it's like limited in what they'll cover, and then what they do cover, it still is like $3,000 a month for the drugs anyway, which is insane. So
yeah, but just to let you know, not that this is a reason to do it, but most of the medications have copay assistance programs that will cover that cost.
Yeah.
And should be, I mean, I can't speak to your specific insurance in your state and what the laws are there, but if there's a big copay, usually that ends up neutralizing to just about zero.
I did have some copay insurance with like Novartis for Gilenya.
Yep.
My main stopper with the DMTs is the liver issue with like the hep B carrier status.
Yeah. Well, it would be safe for liver.
Yeah, I mean, I think it kind of depends. I mean, that would be what we typically do in people who test positive or who have latent hepatitis, either C or hepatitis B, is we have them consult with a hematologist, or not a hematologist, an infectious disease doctor. There are medications that people can take that basically suppress hepatitis B. So I have a number of people who have tested positive, and we keep them on that treatment for at least a year after they discontinue anti-B cell therapy. But you'd have to you'd talk to an infectious disease doctor. So if it ever became absolutely necessary for you to do a treatment, it might be that B cell therapy isn't completely excluded for you. You'd have to investigate.
Yeah, and I have talked with an infectious disease doctor, and actually when I was on Gilenya, I was like taking tenofovir.
Yeah.
I believe. So which kind of was like, it felt like the way I understood it, which it felt like it was like a balancing act, so.
Sort of. Tenofovir basically blocks hepatitis B from being able to, make DNA and be active.
Yeah.
Which, if your immune system is functioning normally, you don't have to, it'll suppress hepatitis B on its own. Yeah. But in the circumstance where you basically open the bottle of hepatitis B, you want to make sure that, okay, if you have that bottle open, it can't do anything. And that's the idea behind tenofovir.
I'm open to like, so I actually have a good friend of mine who was like diagnosed with MS recently, and like some of the new drugs like Mavenclad and like even Kesimpta and stuff like seems promising compared to like a lot of the older drugs. So
well, I think even more promising are the BTK inhibitor drugs which are coming out, which have done trials, at least one of them called tolebrutinib, did 2 phase 3 clinical trials. And in both of those clinical trials, it did have an impact on disease progression in a way that suggests it's doing something different from our current medications, and in a good way. I think we're hopeful that if we have drugs that can penetrate the central nervous system and can affect a kind of inflammatory cell called microglia, which are part of the innate immune system, if we have drugs that can do those two things, we think that they may have a significant impact on progressive disease. And in the clinical trial for tolebrutinib, it looks like it may be doing that. And so these BTK inhibitor drugs, there are a bunch of different ones that are under investigation, and it may be this could be the next big step forward. So I would say just keep your eyes open for opportunities for treatment.
So I'm gonna round it back to the HSCT thing, kind of echoing what Hannah said. I'm really happy that I did it. For me, it was one of those things where it was like, I don't like wondering what if, and it was like, it would have been a big what if. I'm glad that I did it. I would do it again. But when anybody asks me if they should do it, like that's always a tricky answer, because I'm like, well, you need to do what is best for you. And that includes like whatever like DMT you take, whatever you do for your MS, because the thing that is awful about MS, aside from just that it is MS, that it affects every single one of us so dramatically different. So it's like you can't compare notes. Like it's just like, it's like maybe like some things are accurate, some are not. But specifically when it comes to HSCT, like I'm a big proponent of people like, talking to your doctor, talking to whatever clinic you're going to get it done at, and especially talking to other people who have done it about their experiences, because I think that all that information is really important for it.
I'm glad also that you're not looking back and second guessing your decision, because, I think the best that anybody can do is to take all the facts in front of them and try and make the best decision that you can. It's not always going to be the right decision, but the best thing that you can do is be able to look back and say, you know what, I know why I did what I did. I think it was a reasonable decision. I would do it again if given the same information going forward. And it's not very helpful to look back and say, knowing what I know now, maybe I wouldn't have done it, but you don't know what you know now. And it sounds that isn't to suggest, it sounds like things went fine for you. So I think you have every reason to think you did the right thing anyway. But I'm more thinking about how easy it is in general, if people aren't doing well, that they have feelings of guilt, or like they spend a lot of time looking back and wasting a lot of mental energy on something that doesn't get you anywhere constructive. It's
Absolutely.
just, I think the best thing that people can do is, going forward, make good decisions, right? Just
100%.
investigate thoroughly, make sure you get people's opinions, like, from your MS specialist, from your doctor,
Yes.
and then, go forward knowing that, okay, no matter what happens, I know I made the right decision.
Yeah. Well, especially too, knowing that MS and depression are linked, and it's, our depression is a part of MS. The last thing we need is to be second guessing every decision we've made.
Yeah.
We know that is just a recipe for disaster for us. So we don't need to be doing that.
Depression, life.
Yeah, right. Yes. Having children. That's
not having children.
Yes. There's so many things. But definitely, I think I've trained both of these guys, and I appreciate their just tenacity, and they're just really great people. And so I love having them on this, and I also just love their spirit, and they're both like that, very driven, and I want to do what's best for me and my body, and I and not looking back at what should have been, but just making that next step each day to do the best they can for their bodies. And so I've always really appreciated that in both of them. So really, really good. And just, making each day the best that they can, and, with this crazy disease. So I just really appreciate all of what you've been saying, Dr. Katz. And now I want to ask you a couple questions, Dr. Katz, as you
please.
are getting through these clinical trials, and really some big promising ones. What are you most excited about in this next year?
Well, I have to say the BTK inhibitor drugs, because it's one of the biggest unmet needs right now. It's not that I wouldn't be excited about an effective treatment for relapsing MS, but right now our arsenal is so good.
Mm-hmm. Yeah.
And, our arsenal for progressive disease is so wanting that any step forward there will be welcome. And I do think we're getting to a point where that's going to happen. And I tend to be pretty cautious about my optimism, but everything that I've seen suggests that we might be able to be taking a big step forward.
Yeah.
People have asked me in the last, it must have been 5 years now, that people ask me, well, what's new in MS? What are you excited about? And it feels like I've been saying, BTK inhibitors for years. And I think they're just about to come out. So this tolebrutinib is scheduled to go in front of the FDA at the end of this month, and we'll see what happens.
That's awesome.
It is the first of this class of drugs that's going to go in front of the FDA. It doesn't mean it's the best. I think this one might have some baggage with it that will make it not for everybody, but again, it might be we're going to have our foot in the door for treating progressive disease more effectively than we can now. And that would be really exciting.
Yeah. Is that an IV or a pill?
It's pill.
Okay.
Yeah.
Everyone likes that. Yeah, I like that.
Yep.
Very good.
Yeah.
Okay. What would you say in your full practice of what has been some of your highlights that you would say in the last, I'll give you a 10-year span. I won't make you all the way back.
It's going to sound corny, but the thing that I like most, when I come home, a good day for me is when I've seen a new patient who comes in and they're scared. Their whole life has been turned upside down by the diagnosis. And I can spend a lot of time with them. Often I will spend an hour and a half, sometimes 2 hours with them, maybe with their family. And, I tell them, look, there's a lot of things that we're going to talk about today. And you only have to walk out of the office knowing one thing, which is that I'm here, I'm going to take care of you. And if you got a problem, you can.
I'm going to come to you.
You can email me. That's what you got to remember.
Mm.
The rest of it, I can go over 1,000 times, but you got to walk out of here knowing that. And being able to, look, that's traditional medicine, is taking care of people. It's not just treating a disease. So that's what makes a good day for me. It sounds.
No, it's not corny.
When Ocrevus was released in 2017, that was huge. That was a big step forward in treating. I was around when the first oral medication, which was Gilenya, came out, and for many people that was life-changing. And it, I often don't even prescribe some of these early oral drugs anymore because our current drugs are much more effective. But when they came out, it's game-changing. It made a huge difference for people. I never have somebody come into my office on an oral medication saying, when are they going to come out with this in a shot?
Right. Can I have more shots? Yeah.
Right.
No.
So that was good. Yeah. So
that Tysabri came out. That was I remember everyone was excited about that. And I was on Avonex and then get very excited about Tysabri, and everything changed for me. Yeah, that was very exciting.
Tysabri was a game-changing drug.
Yes.
Of course, it was overshadowed by its first release where they didn't know that PML was a big risk.
I was in the middle of getting it when we all got pulled off.
Yeah.
I was like, what's happening? So I remember that.
Yeah. So that was a bit of a rocky start. And unfortunately, ever since then, that's shaken people up. That was like an earthquake that the tremors we're still feeling today, because everybody is still scared about the PML, which was the infection that we saw mostly in relationship to Tysabri. It's still the thing that people are the most scared of. And there is a risk for PML with some of the other drugs like Gilenya and Ocrevus, Briumvi, but it's so much smaller than it was with Tysabri. But so the fear is sort of outsized.
Yeah.
But
I don't know why I wasn't very afraid of that, but I did become, but it was still low. My numbers went down, and I still would have stayed on it.
Oh, I think
And
it's a very manageable thing, but
yeah,
people still have a sort of visceral fear of it in some cases.
sure, sure. Yeah, so I do think that we're starting to see a little bit more excitement about things with MS and the treatment. So that obviously, but like you said, I think that there's some skepticism, people, especially with people who've had it for a long time, because they'll say, "We've heard all this for a long time, like whatever, whatever," and so they don't get as excited. Even running support groups, you can tell the people that are a lot older and they've had it, and they don't get as excited. And I kind of have to keep them a little quiet with the newly diagnosed people. I'm like, easy, easy.
Yeah, I
So
think it's very hard for people who have accumulated significant disability because what people want most, understandably, is something that's going to repair and reverse
yes,
what they have, and that I think is still far off, or
yeah,
farther off. And we have to stop things moving forward before we can turn the clock back. So
yeah.
one step at a time, I'm afraid.
Exactly. What would you say? A question I have, what would you say to patients? I get this a lot in the support groups that don't click with their doctors. And I have to kind of
Find
give them
another one.
permission, right? It's okay to say
Yeah,
goodbye. It's okay to break up
yeah,
with your doctor. You're not married.
yeah. I
Um,
mean, it comes up. People sometimes want a second opinion. I'm like, great, get a second
yeah,
opinion. This isn't about me. This is about,
right,
it's not about my feelings either. This is all about you, and you got to do
right.
what you feel is right. And if it's not
Yeah,
clicking for you, now the problem where I'm located, I'm surrounded by MS clinics. If you don't
right,
like your doctor, you can go on a tour of MS doctors.
right.
I mean, we I will say we see people from all over, but
Yeah,
um, a lot of people, I think in Boise, Idaho, you probably don't have as many options as you would if you were, on the East Coast. So if you have an option and you're not getting along with your doctor, you should shop around
yeah,
to an extent. I
definitely.
mean, if you've gone to 10 doctors and you hate them all,
Could be a you problem.
maybe, yeah. I mean, actually, we
Definitely.
have to say, 1 in 10 doctors, it might not still be a you problem.
Right.
Maybe 20
True.
doctors.
Yeah.
Yeah.
Very true. Very true. But I definitely like to talk about any of the things that you see that are coming, any of the patients that any of the negative things that you're seeing with MS, and some of the things that we need to look out for as far as like patients that are not doing well in some things, or that are, I mean, we're talking about exercise and stuff. Any of, like, that's my main thing, is obviously move it or lose it. Patients that are, I see a lot of that, patients that are not moving their bodies enough, that kind of come and that are just very depressed and just not doing what they can. How do you motivate your patients to just move their body, eat better, and
Yeah.
maybe you will feel better? So
Yeah.
that is,
I'm glad you brought that up, because really we've been so focused on disease modifying therapies, and it's really only one half of what you can do. And this is particularly true for people who have progressive MS, where medications aren't necessarily the answer. Their lifestyle is going to make a much bigger difference, and it does for
right.
everybody. I mean, it does
Yeah.
whether you have MS or not. All of us should be focused on our lifestyle. We know that exercise seems to be one of the best things that you can do for your brain
Right.
and your nervous system, with or without MS. And you only have to do a very simple thought experiment to realize how important it is, because,
Mhm.
it seems obvious, but if you take two people who are identical and you put one on the sofa and make them minimally active and give them an unhealthy diet, maybe have them smoke, and you
Yeah.
have the other person have a healthy, calorie appropriate diet, exercise regularly. You don't have to do anything crazy, but just get up and move
Right.
around. If they smoke, they quit smoking. It's just
Yeah.
no question who's going to be doing better in a very short period of time. And if you
Yeah.
extend that even longer, it's going to make literally a life and death difference over a period of 5 to 10 years. So
Yeah.
unfortunately, it's a big ask for people who have fatigue or
Yes.
leg weakness or muscle stiffness, that doing look, I hate to exercise. I do it
Yeah.
regularly. I find it really difficult um, to do, and it's hard to motivate me to do it. So
Yeah.
it's one of these things you can only ask people so much. And
Yeah.
I think the important thing is to set your sights at a very reasonable level. I think I've seen people who said, what, I went to the gym, I exercised, and I was exhausted for 3 days
Yeah.
afterward, and they just do too much too soon.
Introducing the Pulse device, cutting edge wearable device, revolutionary wellness designed to stimulate circulation, reduce harsh pain and tightness, and speed up recovery. The Pulse device uses advanced vibrotactile technology trusted by patients, clinicians, and wellness professionals. Whether you're recovering from an injury, battling a neural condition, or just want to feel the best every day, Pulse helps you recharge so that you can live and feel better. Lightweight, powerful, and easy to use. Experience better performance, better recovery, and a better you. Order now and save $30 using my code MSDisrupted at pulsedevice.com. The Pulse device is your health recharged. You won't be disappointed. Get it now for yourself. I have it. I love it. Go ahead and grab it.
Yeah, I would say most of my clients' patients have PPN. They have the secondary or primary. And that is, we don't go long time, but let's get the body moving. Let's just start from there and then see what we can do. And it's always very exciting when they call or message me. I stood in the shower and it's like, okay, we're starting to see results now. So it's like, okay, now I want to get off the couch a little bit more. But I think that is such a key. And it, I think that that's helped me through my life is I never stopped moving. It was just in my DNA. It's like, this doesn't make, my grandfather had it, my aunt had it as well. And I saw what it did to them back in the day when it was like, just rest. And I'm like, they're atrophying and now they've passed. I'm not doing that. It's the one rule I'm going to break. And so, it became such a passion for me as a trainer and then training people with MS and different autoimmune diseases. And, I just find it to be very fascinating that, to see the different ways that people are moving
Let me ask you, what have you found is an effective way to motivate people?
It is when taking their money, then they're like, I
Making them
paid for
invest.
this. Yes.
Yeah.
Making an investment in it. I think just when I have the same thing, being able to look at them and say, let's breathe first if you're nervous, and then kind of getting that down and their nervousness, and then starting off and understanding that I have this too. So we're not going to start doing burpees today. We're going to kind of slow down and we're going to make this something we both do. I think that camaraderie and getting their nervousness down is a big part. But I think when you have something like MS, you've already been sitting for a while. So the idea, like you said, of getting up and going makes them a little bit nervous. And so I think if there's a plan that doesn't feel too overwhelming, then it's something, but it's still very hard, Dr. Katz, as you know, nobody wants to. And then when you're sick, it's like, well, but,
I've had a couple of people give me the feedback that it's been very helpful for them to hear how much I hate it.
yeah. Oh, yeah. I always say that. I said, you think I get up and think, I can't wait. I don't. But I will take my weights and stuff in the living room. So then I have to move them all to get to the bedroom. So I kind of make it so it's not everybody's going to think that's as exciting as but it forces me. I'm either going to have to move all the exercise stuff back again, or I can do the exercise.
Yep.
So I always say, put them somewhere where you're going to do it and make yourself accountable. So I think, and also I'll do like a Zoom exercise group where there's people on there. So then you're accountable to each other.
Yeah.
So
Doing it alone helps. Sure.
Yeah,
Yep.
for sure. So I don't know, how did you guys do it when I trained you? How did you guys get the energy to do it? That I was just going to make you my phone call, or that I was going to be on the other end of Zoom? How did you guys, Hannah and Jacob?
Well, I mean, I did. A, like I paid for it, and B, I don't like to disappoint people, and I like to show up to the things. So I would show up to our training sessions. So
Yeah.
it was all one package.
Yeah.
And also, if you pay for something, you should do your thing. And so.
Yeah. Thanks. So what about you, Hannah? What got you motivated? I'm going to do it.
Just seeing some improvement, like when I would do the squats and being able to
you were
do
very
some
good at that.
more And like, just that was something, and you're so encouraging. And I think what speaks volumes is when you have someone like Kathy that can speak your language, gets
I
it.
do think that's important.
That moves mountains. So that was a
Mm.
big drive for me as well.
Thank you. Thank you. I didn't mean that to be like but I think it is when people understand. I think you would agree, Dr. Katz. When people understand what you have, I think that's if you have somebody coming that doesn't understand our world, or that's kind of can be frustrating when they don't know what we have. So.
Mhm.
But thank you for answering. I think it goes hand in hand. I think sometimes the eating can get very frustrating. So I think I always try to come up with, just make sure that you're eating things when there's a label that is so long and so that you don't understand it, probably not good for you. So, I try to not give those kind of lessons that are so difficult, especially with newly diagnosed. That here's your new list, here's your new life. Not only are you diagnosed, but you have to do this much exercise, you have to change your entire diet. And so probably what you would do.
Right. I mean, I think that's really important, particularly for people who are newly diagnosed, is just not to overwhelm people with how much their life is going to be different.
Right.
When I'm trying to tell them really how much your life is going to be the same. There are going to be some additions. It's not going to be exactly the same, but you got to focus on all the things that you're going to do just like you did before. And, so when people ask, well, what should I be eating? I want them to think, okay, look, let's get 6 months into this, and then we can talk about the big lifestyle modifications and diet, if we even need to do that, if you're not eating healthy. But it's a lot to process when you're first diagnosed.
And it's very smart to not give them, let them be diagnosed for a bit, let them kind of get their
let the dust settle and just get back on your feet.
Very smart. Are there any questions, Jacob and Hannah, that you have for Dr. Katz before we end today? You got him right there. So
I know. I'm like, oh my gosh. Well, I think you've touched on it, like what you are excited about, like the BTK. Obviously with me with primary progressive, I did start back up on Ocrevus in December. I was off the whole time. I was declining, and I kind of held off because I was trying to do some other things to maybe combat it in a way outside of medicine. But I got back on, and but I sometimes, well, I guess this is a question because like I sometimes don't even know what to ask my neurologist when I go. I did ask about clinical trials when I met with my neurologist for the first time last year when I switched Mandel centers, and she kind of just said it's not something that they really do. I mean, it just so I because I had seen a few, but outside of that, it's kind of like, and I don't really know to ask. And I've had some significant progression I've been experiencing in the last year, but more so since April. And it's been a lot. And so I'm going to speak to her in October, and I'm like, I'm overwhelmed on like what to even ask. And there's times that they recommend PT and OT, and I get that. And I've done it. But I guess that's a question of like, what are great things to ask? And you think I'd know by now. I've been in this since 2017, but I don't know.
I think that's a hard question, actually.
Yeah.
What you should ask. I mean, I think you can sort of break it down a little bit. Like, first, you have disease modifying therapy. Am I on the right one? Is there any new information about Ocrevus and progressive MS? How long should I stay on treatment? And a lot of these things, the answers are, I don't know. I mean, people ask all the time,
Right.
am I getting the right dose of Ocrevus? We don't know what the right dose of Ocrevus is. We know.
Right.
So, you can focus on DMT questions. You can focus on symptom questions. So for whatever symptoms you have, you can make a list and say, am I on the right treatment for this? Go in with a list of symptoms that are bothering you, and just, am I on the optimal treatment for this? What should I be doing differently? And, and if there's time, when do I need another MRI? It's an important question. And why? Not just the answer, but why is that the answer? I like people to know, you don't need an MRI this year. Let me tell you why I don't think you need an MRI this year. Why you do. Because otherwise you're just doing what somebody's telling you to do and not really understanding the rationale for it. And, not that everybody wants to know, but I think it's good to
That's
come
smart.
away with like, okay, now I know what the plan is and why we're doing it.
Yes.
So maybe direct your questions to answer those.
Yeah.
That's excellent. I really appreciate that. Can I snag one more quick question? I'm sorry.
I'll be here all night.
Okay. And with primary progressive, my MRIs have been stable since 2017. And so I'm not surprised when they come out. I'm like, all right, cool. And obviously if something did change, that would, concern me. But I was told, I was explained that it operates on a micro level, and that's why you don't see them in the images, the changes. So I was just curious what your answer is to that.
Yeah, well, it's funny because when I was doing these talks in Missouri, one of them is all about MRI, and the main thing is, why am I getting worse, but my MRI looks the same? And the MRI is not a perfect tool. I mean, we can see a lot with an MRI, but there's a lot that we can't see with our standard MRIs. And in progressive forms of MS, it may be that we now are able to see certain things on specialized MRIs that do correlate with progressive MS. So there are what are called slowly expanding lesions. If we look at the volume of a typical MRI lesion is called a T2 lesion, and if we look at the volume of a T2 lesion over time, they tend to get bigger. Not all of them, but some of them can grow. But it's very hard to see that on a standard scan, and it's hard to see that in a 6-month or even 12-month period of time. It's something that you can see more over a 2 to 3 year period of time. So it's like watching the hour hand of a clock. It doesn't look like it's changing, but if you look at it long enough, you can see that it does actually change. So, and these aren't things that you measure in a standard MRI. So that's part of it. And the other part of it is that some of the lesions have inflammation at their edges that you can image in specialized ways, but aren't available on today's routine scans. So at the edges of some MS lesions, we can see that there are deposits of iron, and that is associated with activated microglia. Those are these inflammatory cells. And there are MRIs where we can look for these. They're called pearls, paramagnetic rim lesions. And this has become a big thing in MS, is to image these pearls, because we know that that does correlate with progressive MS. So on today's MRIs, we don't see much that correlates with slowly progressive symptoms, but that may not be true for tomorrow's MRIs.
Right.
So the specialized MRIs, are they available?
Yes and no. Like there are some radiologists know how to look for these pearls, but it's not a standardized thing. So I would say that these are still things that are a few years out from being standardized and being able to be measured in a reliable way. And you know what? Here's the thing. It's not really that important to image that. If you're getting worse, you're getting worse. That's what we need to know.
Right.
Seeing it or not seeing it doesn't change anything. It's really going to matter when we can image it, but you're not getting worse. And we say, okay, well, you have the markers for progressive disease before you're progressing, and when we have something we can do about it. Right now, seeing it doesn't necessarily change what we're going to do for you. But when we, I could see in the future, though, we could do an MRI and say, oh, look, there are 3 of these paramagnetic rim lesions, these pearls. You're doing well, and you're on, let's say, Ocrevus, but this is a marker for chronic inflammation. Maybe we should switch you to a BTK drug for any problems. That's when it's going to be useful.
Yeah, very interesting.
Presuming that, that these drugs work, they're supposed to.
Yeah, but something exciting finally to look at. Very good. Jacob?
Thank you.
Yeah, I just have one question, which I feel like you may have indirectly answered earlier, is so obviously the concept of remyelination. When do you think that, because there's a lot of talks about it and whatnot, but it doesn't really seem like it's moving forward. When do you think that will potentially be a thing? I think the thing that you answered indirectly earlier, which was figure out how to stop the progression and then to bring it back. Is that kind of in the same
Well,
field?
I mean, I think what we found about remyelination is that it's a very delicate process. It's a very complicated process, and it's easy to disrupt that process if there's ongoing inflammation and you don't have exactly the right environment to remyelinate. So I'm not sure that this is true, but my thought is that remyelination therapies will be more effective once we're able to shut down chronic inflammation. And there is another problem with remyelination therapies, which, if you look at your average MS lesion, you've lost a lot of nerve cells, not just myelin. So, if you've lost 50% of nerve cells, you don't have as much to remyelinate. Now, that isn't to say that that won't be an effective strategy, both for restoring function and slowing progression. But I'm a little worried that people are thinking that remyelination therapy is going to be the difference between being in a wheelchair and walking again. And I don't think it's going to be that profound a difference.
Okay. And that makes sense. Like, it seems like it's a very big beacon light that, like, but but getting from point A to point B seems very complicated.
Yeah. I mean, it is a little bit like unscrambling an egg. It's much, much harder to do.
Yeah, that makes sense.
That does make sense. Thank you for that.
Yeah.
And just one more question, Dr. Katz, do you have any patients who do cryotherapy for their MS inflammation?
Probably one or two who have done it. I am, just so you know who you're dealing with here, there are people who are like open-minded to alternative therapies, and then there are skeptics, and I'm like off the screen.
That's fair.
I tend to be very, very so red light therapy and cryotherapy. For every study that shows that they're effective, there are clinics opening up left and right that offer it for just about every treatment. And, I'm not saying it doesn't work, but anything that costs money and doesn't show me a clinical trial that's a reasonably good clinical trial, I'm reluctant to advise my patients to do. And that's true for supplements, and it's true for a lot of alternative therapies. I'm not against it. I just don't want to recommend it either. And I'm also very sensitive to the fact that, the way I put this often to my patients is from this side of the desk, the doctor side of the desk, I'm very reluctant to put my patients in harm's way and have them be taken advantage of. And there are so many things out there that are just advertising to you and telling you this is a solution for this and that I really feel very protective of my patients, not getting caught up in that. But from the other side of the desk, if I'm not doing well and my doctor has offered me everything that he can, and I'm still not doing well, and somebody says, well, you know what, try this and see if it works. Yeah, I'm probably going to try it. I totally get it. I think that if it's not going to hurt me and I'm willing to take a chance on it, why wouldn't I try it? And you know what, even if it's a placebo effect and I feel better. So, I'm sorry for the long-winded answer there.
Oh.
No, I think it makes sense.
I mean, so the reason I ask, I do cryotherapy once a week. It's in a machine that's the machine is not based on the gas or whatnot, but it's based on fans, and I do it once a week, and while it doesn't last for the entire week, it gives me relief for days because my legs are normally really, really tight, and then after I do it, I feel better. But also because of MS, my body temperature is just up all the time. I think that really affects it more than anything. It just reduces that inflammation in my legs and in just my body temperature regulation. So,
well, I'll tell you, my one personal experience with something like that was that I have a friend who has a hot tub and a cold tub. And, the cold tub, he had the water at 50 degrees.
Yeah.
And it's like a refrigerator on side. You got out of the hot tub and you immerse yourself in this 50-degree water.
Yeah.
And it was just, it's exactly what you would imagine. It's just just sort of everything shrank up and just felt painfully cold for about 10 seconds. And then you started to accommodate.
Yeah.
I got out great, get back in the hot tub. Everything's tingling. And I'm oh, that was awful. It just was terrible. But an interesting thing was that there was also this weird endorphin release. I'm like, I think I want to do it again.
Yeah, I know.
Yeah.
I did it in California. I did the
Yeah.
same thing. I was like, this is horrible. I don't want to do it. But after I
Yeah.
was like, wow, I feel great. Like it was the same.
Yeah,
I was like,
so
why
who
are we
knows
doing
what
this?
those endorphins are doing for you? You know, it could be
Yeah.
all sorts of, you know, the effects of it could be more than just anti-inflammatory.
Mhm.
So it's interesting.
Yeah.
Yeah. So the thing, like, I've done a cold plunge before and it was awful because it was water. Whereas
Yeah.
like the cryo machine, it's there and it's like, it's dry. So it's like the fans and then it's off.
Yeah.
And I think that is light years better than, because when you get into something that cold and there's water involved, it's just a different kind of cold, and it was awful.
Oh yeah. It sure
Now I
is.
do
did
that
not
in the
like it.
shower. I take my shower at the end. I make it very cold, and then maybe I just like punishment. I don't know, but it just makes me feel better to make it freezing, and then I get out.
You know what?
Yeah.
If I could live an extra 50 years by doing that, I still wouldn't do it.
I understand. My kids think it's crazy, but
My
well,
biggest advice about any of the alternative therapies, just to say, is I'm just fine to do them, but I don't look at them as something to do instead of the traditional
Right.
therapies, but in addition to.
I agree. Yeah, I agree. If it makes you feel better, I think it's really important. And there's a lot that I'm studying right now to which I'll talk to you about later. Not tonight because I think we've exhausted you. But I do want to say thank you so much for today. I really appreciate all that you've given us, and really we got to touch on so many things, and I really appreciate it. And also Jacob and Hannah, thank you for being on with us. And Dr. Katz, I can't say that I won't be calling you for another podcast with some other things, but I appreciate it. And it was so good to meet you. I've heard so much about you, and finally I was like, you know what, I'm just going to call and see if he'll be on our podcast. So thank you so much.
My pleasure. It was nice to meet all of you, and I would look forward to doing it again.
Thank you so much.
Awesome.
Will you
Thank you.
enjoy your day? And thank you. And I will let you know when this airs. I will when
Terrific.
Jacob tells me. And you guys have a great night. And again, thank you guys for listening to another episode of Move It or Lose It. And we will see you guys next week. So enjoy your night and goodbye.
Bye, everybody.
Hey,
Bye, everyone.
Bye, guys.
thank you.
Thank you so much for joining me for another episode of the Move It or Lose It podcast. It would mean the world to me if you subscribed and left a review. Remember, you can find me on Apple, Spotify, Stitcher, and YouTube. New episodes of the Move It or Lose It podcast air every other Wednesday. If you have any suggestions for future guests or topics, please visit my website at www.msdisrupted.com. Until next time.